Hello everyone, and thank you for joining us for Enloe Medical Center's Healthier You Facebook Live series, where today we're going to be focused on summer safety. Summer is the perfect time of year to enjoy the great outdoors, but these adventures can turn dangerous as more people hit the trails, enjoy their favorite Chico swimming holes, and enjoy all that Chico and the surrounding areas have to offer. At triple-digit temperatures, and caregivers know that trauma season is in full swing. Luckily, Enloe Medical Center FlightCare program can reach folks in remote locations and provide medical assistance quickly. Hello everyone, I'm Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator, and I'm joined today with Chief Flight Nurse Jenny Humphries.
Good afternoon.
Thank you for being here. And she is here with Enloe's FlightCare program. We're here on top of the roof here at Enloe, which is very exciting. And we're going to be talking today about summer safety, common injuries, and what you can do to avoid these. We'll also get some history on FlightCare and how it makes a difference in our community. But before we get started, please remember the information we're about to share is not intended to be medical advice. If you have questions about your health or summer injuries, please make sure you talk to your provider. But throughout the broadcast, please feel free to add comments in the comments section, and we'll do our best to address them during today's broadcast. With that, we'll get started. So, as we mentioned earlier, again, well, thank you for being here, first of all.
Thank you for coming up to the helipad. Good afternoon. Welcome.
Thanks for inviting us. It's very cool. But we mentioned earlier this is known as trauma season. Can you tell us a little bit about that?
Yes, the late spring, summer months really, and goes without saying, we live in a beautiful area that has a lot to enjoy. And so with kids coming out of school, the weather being so gorgeous, it encourages people to get outside and be active, which is exactly what you should be doing to lead a healthy lifestyle, but it can come with some extra exposure to trauma. People are more active in their boats and on the water and hiking and ATVs, Jeeps, all of those things. And so it does just provide more of an opportunity for traumatic injuries to occur.
Okay, so these injuries, what are some common injuries we see? And then do they vary between children and adults? Are they the same? Are they different?
You know, really, obviously, adults can be a little bit more active in in the boating, sort of water skiing, wakeboarding, hiking, those sorts of things. Children, though, however, also enjoy the outdoors. So I would say adults kind of are more under the vehicle trauma and those sorts of things. Falls from climbing, probably places maybe they shouldn't be. Kids, it's generally more submersion type injuries, drownings, near drownings. And so with trauma, it's generally things that come as a consequence of being exposed to the outdoors, being at a fall, vehicle accidents, boating accidents, those sorts of things. And then the summer also comes along with some medical concerns with increased heat. And those generally affect our really little population and our elderly population, and those in between that have pre-existing medical conditions are more at risk for the heat-related injuries.
Okay, so what can people do to prevent these injuries?
Be prepared and be aware of your surroundings, I think, is the two things that you can do that'll be the best as far as injury and illness prevention. When you're going to set out for a day to enjoy our area, be sure that you're adequately prepared with hydration. If you're going to explore somewhere you've never been, maybe let someone know where you're going and when you expect to be back, so that way if things don't go as planned, someone can be looking for you. And just general awareness of your surroundings, especially if it's, Upper Park, for instance, is someplace that many people are very familiar with. But in this time of year, there's snakes, for one, that are much more active in Upper Park. And so maybe not just with your headphones in, not paying close attention so you can't hear the polite warnings they give you with a rattle, but generally being aware of your surroundings. When you're taking your selfie, backing up toward maybe a swimming hole that has a drop-off is not the best idea. So I would say being prepared and being aware of your surroundings are going to do you the most favors as far as preventing trauma and illness.
Perfect. Okay, got it. Prepared and aware. Perfect. So can you tell us a little bit about FlightCare and how it helps during this busy time of year, how long the program has been around, and what are the benefits about having it here in our community?
So FlightCare has been here at Enloe Medical Center since July of 1985, so we're 34 years. We've got a big anniversary coming up next year. And we're unique in that we're the only hospital-owned and operated air ambulance program in the state of California, where that was much more common in the earlier years. That has been a less common method now. We gotta go. We're gonna pause and let the helicopter leave and we'll be back to you.
Hi, and we're back. and you'll see that we're without the helicopter, and that's how fast it happens. So with that, Jenny, tell us a little bit about that. How quickly do you guys need to make it happen?
Well, thank you guys first for your flexibility. So the aircraft is in service 24 hours a day, 7 days a week, and so we definitely took on this challenge knowing it could leave at any moment, and that's exactly what it did. And so we may be interrupted again for their return, but we'll know about that. Generally speaking, 90% of the time we are from time of request to off the roof in under 8 minutes or less.
That's
now
impressive.
that is without rushing. So there's definitely deliberate steps and safety mechanisms in place that start from the time the call is received until we leave and throughout the flight. And so there isn't a rushed, hurried nature to us leaving the pad. And as you got to see the crew, there's a regimented, very organized approach to how we safely operate in and around the aircraft. And we're able to do that efficiently and more often than not in less than 8 minutes.
That is amazing.
Yeah.
Wow. Okay. So so let's talk a little bit about what's inside of the helicopter. So what would we see? So if someone does need flight care services, what can we expect? And share a little bit about that.
Okay. Well, obviously it'd be great that you could take a look, but it's gone. Anyway, we might be able to get you some photos later on. But what we try to encompass in there, so critical care transport medicine is really a specialty in itself, and we need to be able to take care of everything from the tiniest patient to an elderly adult patient, pregnant, high-risk OB patients, and everything in between. And so we really encompass everything we may need from an emergency department or ICU to be able to take care of those patients in transport between hospital to hospital or from the scene of an accident to a hospital. So mechanical ventilators, IV pumps, a really well-developed pharmacological med bag that allows us to do a whole lot of initiation of medications that generally would only be here in the hospital. Things for the immediate stoppage of bleeding, establishing an advanced airway, delivering a baby, really anything you could think of, we need to be prepared and able to do.
Yeah.
And so we have things very strategically placed because we can't put everything in the helicopter, make it so heavy that it can't leave, but we need to have everything that we need to take care of a patient. So really anything you might find in an ER or an ICU, and even a newborn nursery to a certain extent is what we have on board at our disposal.
And who's in there? Who's part of the team?
So your flight crew is a pilot, a flight nurse, and a flight paramedic. Occasionally we'll have 2 flight nurses on board, but our general staffing is flight nurse and flight paramedic along with our pilot. The reason being is the paramedic comes with more of a pre-hospital focus, and their training is more in the pre-hospital care and stabilization, where the nurse comes generally from a hospital background. So you blend that pre-hospital with the hospital ICU ER background, and together that really gives us the broad skill set we need for all the patients we might encounter.
Okay, so how many people does flight care typically help in a summer?
Our summer months definitely are busy. I think
about in a
year? Last year we flew 902 patients in a year, which is a very busy one single helicopter program. So we definitely keep busy.
Yeah, and how far does the helicopter travel?
Well, for our immediate scene response, which is what people think of accidents and things, we're at about a 70-mile radius.
Okay.
But we do a lot of, especially with the regionalization of healthcare, we do a lot of hospital-to-hospital work. And so we go here to Sacramento, here to San Francisco. We'll go to Stanford and Palo Alto, down to Santa Clara and San Jose is about as far south. We do Mercy, Mount Shasta, and occasionally get over to some of the hospitals in Reno. So we cover a pretty big area here in the North State.
That's really great. So this has all been great insight. Thank you again for joining us. Is there any last words of wisdom that you want to share with us before we end today?
I think it just goes back to being aware of your surroundings. Take the time to enjoy what our area has to offer because it's amazing and it's beautiful and it's good for you to get outside and enjoy that.
Yeah.
But be aware and be prepared. And also from our program, we appreciate the community's support and we definitely feel very privileged to be able to take care of the people in our community. So thank you.
We thank you for taking care of us as well. So thank you again, Jenny, and everyone for joining us today. And we will see you next time when we get to be joined by Enloe the dog and learn about his training to sniff out cancer. So goodbye for now.